have the honor to have Dr. Hussein Shaish as my supervisor. Today I'll talk about two things. First, my elective and then my essay. My elective was in 3 places actually. First, I went only 1 week in the nephrology department, urology and nephrology center. Then I went the rest of the 3 weeks in the Merck, where I learned a lot of things and worked by my hand. Dr. Muhammad Ahmed Sabhi gave me the honor to work by my hand to the stem cells, from counting the cells until nutrition and sub-passages. Then I went to the oncology center. My supervisor, Dr. Basir Rif'i. I mainly stay in the outpatient clinic. I see a lot of cases. We learned how to do examination, how to take a history, how to convey bad news, as most of the case was cancer breast. And we see a case of, which is really uncommon, a case of breast cancer with satellite nodules and cancer in pancreas, which is uncommon to see.
Most of them, the same patient?
Yes,
cancer
satellite nodules and cancer in pancreas in the thorax and upper abdomen.
Oh. Is it related?
Yes, lymphatic. They spread by
same tumor or
breast cancer.
Yeah. Oh.
Okay, then my essay is about the secret beyond stem cells in acute kidney.
For the injured tissue, and then he added hepatocyte growth factor, what we call stem cell enriching strategy. So there is 4-fold increase in the infiltration of mesenchymal stem cells to the kidney. Always previous beneficial. Let's look at this other side of the coin now. How can stem cell therapy for organ diseases rather than the kidney affect the kidney? It may be early and before acute kidney injury. B-sepsis is the most common cause. Other causes include use of nephrotoxic drugs, sinusoidal obstructive syndrome, or late in the form of chronic kidney injury or proteinuria, with or without hypertension, and it is thought to be a manifestation of graft versus host disease. These are pathological slides of kidney biopsies after stem cell hematopoietic stem cell transplantation. This is the first one, acute tubular necrosis with shedding of the cells inside the lumen of the tubules. The second one is intimal arterial hyalinosis without medial involvement, which is characteristic of hypertensive encephalopathy. Third one is thrombotic microangiopathy with fresh thrombus at the vascular wall of the glomerulus. To summarize, stem cells are unspecialized cells that differentiate and self-regenerate. Stem cells involved in renal regeneration include stem cell niche and extrarenal stem cells. Renal papillae as stem cell niche is still highly controversial. Bone marrow stem cells play a role in maintenance and the repair of renal mesangium and endothelium, but not the epithelium.
Possess this pump pathogen-associated molecular pattern by which it's recognized by PRRs. There are so many types of PRRs, like toll-like receptor, node-like receptor, rig-like receptor, but toll-like receptor is the most studied of them. Okay, this is what's toll-like receptor. However, toll-like receptor is it's given a definition to be a part of innate immunity. It shares in so many parts of immunity. So it starts from the initiation of inflammation, on epithelial barriers, on antigen presentation, on macrophage, on mast cell, and also adaptive immunity and in tissue repair. Initiation inflammation, it helps recruitment of the leukocyte and the expression of plasma protein. While on epithelial barriers, it's the first step of recognition of the pathogen. When recognized on epithelial cells, it causes release of cytokines and chemokines, and finally the start of the process of inflammation. It helps in all functions of macrophage. It causes direct stimulation of the mast cell and degranulation. On adaptive immunity, it acts directly on T and B cell. Here is the TLR acting as a bridge between innate and adaptive immunity. When a pathogen, under steady conditions, dendritic cell BC is abbreviation for dendritic cells. Under steady conditions, tissue-resident dendritic cells are immature. When a pathogen enters, it's maturated or stimulated, activated to mature dendritic cells via TLRs. Okay, and then the mature dendritic cell cause T helper 1 cell polarization. And here is how it acts as a bridge between innate and adaptive immunity, while its definition is a part of innate immunity. It also helps in tissue repair and wound healing. In human disease, it affects in immune deficiency, number one. NEMO and IRAD4 genes are two genes responsible for TLR.
Is the number one cause of death in children, followed by congenital malformations, hematologic and cardiological problems. Leukemias account for 40% of the total cancer in children. According to SEER, the surveillance, epidemiology and results, which is a program of the National Cancer Institute, through the years, the incidence of cancer has increased in children below 15 years old, while the mortality has increased. So how come this statistics can work?
Cancer increasing and mortality decreasing, right?
Exactly, because of advances in strategies and strategies of treatment and management of cancer patients, the mortality has decreased. But at the same time, for example, I will give you some, from the 70s until now, it's changed from 80% mortality to 80% survival, which is a dramatic shifting or turning upside down of the results. Also, in 5 year, in the solid tumor, the 5-year-old survival has been recorded at 67%. And for leukemia alone, it approached 90%, which is actually a major advance in practice of oncological care and medicine. While at the same time, those protocols, this very same protocol that caused this decrease in mortality of cancer, they are responsible for a lot of complications and life-threatening events in those patients, which increase the demand for critical care services in hospitals, which by themselves, unluckily, can cause unavoidable complications, most important of which is infection due to immunosuppression treatment.
This is the first time for me to be here in Manchester, and I have to say I can advise to replace this method of teaching and instead of the conventional one.
So you are now convinced by my advice?
Yes.
Yes. We are proud.
It's difficult for me to discuss and say from a student.
Thank you.
أبقى امبريزد بيه جدا. عشان يبقى في طالب في سنة 6 الوقت في سنة 6 يعني في مستوى سنة 6 سمستر 2 إن يعمل المجهود ده يعني وانا مش المفروض يعني 150 انا اديله بالمستوى بتاعه انه طالب 150.
شكرا شكرا.
يمكن اظلم غيره لكن يا ريت انا كنت امتحنتهم كلهم صراحه والله جد.